A joint approach to cannabis CPD, living, multimodal, and customized education. With its recent legalization, patients are increasingly approaching their health providers for information on recreational and medicinal cannabis. The UBC Division of Continuing Professional Development has consequently partnered with the BC Ministry of Health to develop and deliver effective education to equip providers with the knowledge, resources, and tools they need to meet this emerging patient priority. However, developing cannabis education for healthcare providers today can be challenging for several reasons. First, how do we develop education that is clinically relevant for a wide range of providers? Different providers have different educational needs depending on their practice scope, context, and the populations they work with. So, for example, a provider who works in addictions counseling with at-risk youth is probably going to be looking for different information than, say, a family physician working in a typical office environment. Second, research evidence on the benefits and harms of cannabis is rapidly evolving, and any education we developed needed to be able to adapt efficiently and be responsive to new clinical trials as they emerged. Finally, health providers, like anyone else, have certain ways of learning that work better for them than others, so we needed to develop education that would cater to this diverse range of learning styles. To address these three challenges, our project adopted what we call a joint approach to educational design. But what exactly is a joint approach? In a joint approach, we presented learners with a diverse palette of educational offerings from which they then constructed their own customized learning programs based on their own unique practice needs. All of the activities were made deliberately modular and self-contained in order to facilitate that high level of curriculum flexibility. To address the rapidly evolving evidence base for cannabis therapeutics, we integrated dynamic, responsive, living resources into all learner activities with provisions for continual updating and maintenance of content over time. Finally, we were also able to leverage multimodality to provide content in the learning formats most effective for their delivery. In the Cannabis for Healthcare Providers program, learners have a variety of activities to choose from, including webinars, online modules, dynamic living point-of-care resources, and small group workshops. Health providers then pick what, when, and how they want to learn. Multiple perspectives from cannabis experts, researchers, and clinicians jointly inform the development of content. Our efforts to maximize educational relevance for many types of providers has resulted in excellent uptake of learning activities. For instance, since launch in July 2020, health providers working in over 37 different practice contexts have participated in the program. So the first modality we offered was in the form of an introductory webinar. Topics included benefits and harms, evidence base, prescribing and documentation, and harm reduction strategies. We invited an expert panel consisting of a family physician, palliative care specialist, pharmacist, and researcher. Together, they spoke about medical cannabis from a variety of perspectives and areas of expertise. Health providers were able to submit questions prior to and during the webinar using an online platform. Other participants then voted on the questions proposed by other providers, and the most popular questions were addressed during the Q&A portion of the webinar. In total, 435 providers registered for the webinar. Want to take a look? A recording of the webinar is available for viewing at any time in the UBC CPD webinar archive. The second modality was in the form of an online module hosted on the UBC CPD e-learning website. It is free to access and accredited for both MainPro and MOC credits. The module provided foundational knowledge on a variety of topics related to both recreational and medicinal cannabis. These included legal status, pharmacology, trauma-informed care, practice standards, evidence-based indications, screening for cannabis use disorder, products, prescribing, and acquisition of cannabis. Learning was further reinforced through the use of pre- and post-knowledge assessment, interactive resources, and clinical case studies. The broad clinical relevance and wide educational reach of the online module was reflected in its excellent uptake. Since module launch last July, nearly 1,500 providers have enrolled in the module, representing over 30 different disciplines. The third modality was in the form of dynamic living resources. Since the cannabis landscape in Canada is constantly shifting and changing, education needs to be able to adapt and respond quickly as new research emerges, clinical guidelines change, or learning needs of health providers evolve. To address this challenge, we developed 3 dynamic, interactive, living resources. The first resource was a sample prescription for cannabis that a typical physician might write. A needs assessment we conducted prior to content development revealed a substantial need for practical guidance when prescribing. So many of the providers we spoke to were uncertain about things like starting doses, monitoring, titration, and supervision, and they really seemed to want a resource that would walk them through step by step how to write a prescription. And so we developed this resource in response to that feedback. The second resource is a clinical flowchart which summarizes evidence-based indications, screening for cannabis use disorder, and clinical pearls from cannabis experts. It includes a variety of embedded resources and serves as a recommended algorithm to be used when interacting with patients at point of care. Interested in taking a look? This flowchart is available for download through the Cannabis for Healthcare Providers online module or via the UBC CPD webpage. The third resource we developed was an evidence grid consisting of concise summaries of the current state of evidence for medicinal cannabis. Although current preliminary guidelines do not endorse cannabis for most medical conditions, we do recognize that evidence is changing and changing rapidly. Topics chosen for the evidence grid were those for which high-quality evidence has yet to emerge due to the recency of research interest in cannabis therapeutics. These research summaries are reviewed and updated on a quarterly basis indefinitely. Finally, the last modality offered as part of the Cannabis for Healthcare Providers program was a series of small group in-person workshops. Again, it is accredited for both MainPro and MOC credits. Intended to complement the didactic knowledge acquired through completing the online module, providers were now encouraged to apply their knowledge to daily practice. So we had participants break off into smaller breakout rooms and discussed 2 clinical case studies facilitated by a family physician and cannabis expert. All small groups then reconvened to engage in a larger debrief and discussion on any clinical insights and lessons learned. Since we started running these workshops in September of 2020, we have had 435 enrollments with approximately 20 health providers per workshop. Looking forward now, how do we continue to provide quality, updated education on cannabis for healthcare providers? Well, to ensure that all content is current and, importantly, stays current, education is continually updated as new evidence or clinical best practices emerge. Program evaluation occurs on an iterative and cyclical basis at regular intervals. Data sources include both performance indicators, such as online course evaluations or webinar ratings, and topic suggestions for further education. Evaluation results then inform the ongoing improvement and steering of future educational offerings. Thank you for your interest in the Cannabis for Healthcare Providers project. For more information, please feel free to contact a member of our team at the UBC Division of Continuing Professional Development. We would love to tell you more.